Hello, everyone. In this lecture, I will be going over development and infancy with a focus on sensory and perceptual systems and motor development. We'll start with a little refresher on Piaget's sensory motor stage. So a couple of reminders about the theory. First, Piaget believed that before you could say a child had a skill or had moved on to the next stage, they needed to master the skill and to master all of the skills associated with a given stage. You can think about learning math to help you understand this concept a little bit better. For example, you can't start adding numbers together until you've mastered counting. Okay? Piaget also believed that knowledge was stage-driven, meaning that all children in a given stage have all of the skills of that stage. Note that it's now more readily accepted that development is domain-specific rather than stage-specific, meaning that you can master knowledge or skills in certain domains before others. So if we come back to math, you may struggle with mastering math, which is one domain, but excel in reading, right? So oversimplified, but may be helpful. This is relevant when we think about the effects of trauma on emotional development. So remember that it's often observed that a person's emotional development gets stuck at the age in which they had their trauma. They develop in various other areas, cognitively, socially, etc. But when it comes to emotion, they're pretty stuck in many cases. They can't process the trauma and they struggle with coping with other intense emotions, which lead to things like relationship conflict. So keep this in mind as we begin to explore this first stage, the one that infants are in, the sensory motor stage. Okay, so according to Piaget, young children start in the sensory motor stage, and some important concepts here include sensory development, interconnectedness, and motor development. This stage is characterized by using the 5 senses to learn. Rather than learning through language, infants learn through interaction with their environments. When an infant engages in a certain behavior or is exposed to certain stimuli, visually or auditorily, these experiences create neural networks that link areas of their brain. The more frequently these experiences occur, the stronger and more rapidly neural connections are made. So you can think about how babies put everything in their mouth, right? They respond to sounds dramatically, they reach for new things, and over time, their interactions and movements become smoother and more intentional. We'll start with looking at hearing. Sounds provide the earliest link between newborns and their caregivers. Remember that fetuses are sensitive to sounds in utero. Shortly after birth, newborns begin showing preferences for sounds associated with their mothers, including their voice, songs they sing, and so on, likely due to hearing these same sounds in utero. Young infants can also detect changes in loudness, pitch, duration, and location in sounds. Some of these different abilities may be evolutionary, such as startling or leaning back when hearing sudden noises to protect oneself. Infants also prefer language sounds. While infants start off being able to pick up differences in sounds between different languages, like recognizing what is Spanish and what is French, for example. Now, they can't label that per se, but they can pick up on which sound goes with which language, much better than adults could do. By around 6 months, speech perception becomes more tied to their native language. So they start off being able to pick up these small differences, but by the time they get to 6 months, they have become more specialized, you can say, to their native language, the language that they're hearing regularly. So when they begin to babble, they do so with sounds that are consistent to their native language and associate meanings to certain sound combinations that they've heard. From a mental health standpoint, you might consider how having a neglectful parent who does not speak to the child or whose home is filled with arguments and fighting could impact the developing child's formation of language perceptions of the world. Okay, next, vision. Okay, so for sighted infants, visual stimulation is an early and continuing source of information that's especially useful for social interaction. By gazing into the eyes of the mother and others, babies use vision to form social connections, focus attention, and gain information. They respond to novel or new stimuli more, which we can see in that they look at the object longer. This makes sense for learning purposes. Once they're familiar with the object, they look away from it faster. And this is called the habituation paradigm. And you can see a video of it in action on our Canvas page. This doesn't quite work the same for faces, however, which infants prefer. Further, it was originally thought that infants didn't realize that objects continue to exist when they're out of sight for a while, a concept called object permanence. This was tested using the hidden objects test, and infants younger than 8 months stopped looking at an object when it was hidden. However, later studies indicated that although the infant didn't look for the object by reaching to pull off the cloth that was covering it, for example, they may have some understanding of permanence as young as 2.5 months old. And part of what was keeping them from searching from the object in the hidden objects test was a motor limitation. They couldn't control their hand enough or coordinate enough to pick up the thing that was hiding the object. You can see videos of these on Canvas as well. Unsurprisingly, infants are especially interested in faces and prefer to look at them as opposed to other things. Evolutionarily, babies have an optimal focus on objects that are around 20 centimeters away, which is approximately the distance between the mother's face and the infant when cradled for breastfeeding. This helps to explain why by 3 months, almost all infants can distinguish between a familiar face and that of a stranger. Socially, infants are able to discriminate and imitate happy, sad, and surprised expressions of a face by 1 or 2 days old. Then they can produce these facial expressions without a model being present by around 1 to 2 months and start to associate feelings with these facial expressions in others by 4 to 7 months. Perhaps even more interestingly, infants demonstrate distress when the face that they are looking at is unmoving or emotionless. Infants anticipate a normal sequence of facial movements in human interaction, and when these don't happen, they get confused and distressed. You can begin to consider what the implications of this might be for a parent or caregiver who is struggling with mental illness and cannot be as emotionally responsive or available to the child. Next, there's taste and smell. So newborns can tell the difference between sweet, salty, bitter, and sour tastes, and they show preference for sweet and salt. Their overall preferences are significantly influenced by the flavors transferred to them through breast milk if they are breastfed. Breastfed babies tend to be more willing to taste different foods compared to formula-fed babies, suggesting a link between exposure to novel tastes and later taste preference. In terms of smell, babies recognize the odor of their mother's milk, and this familiarity strengthens feelings of comfort and increases willingness to suck, which is necessary for survival. Now, with touch, touch is used for communication and exploration in infants. Playful touch, gentle handling, and soothing touch evoke smiles, allow the child to interact with the environment, and can calm them. Babies also reach out and touch things to explore the object's size and texture and facilitate their learning. Now, although I've spoken about each of these senses separately, anyone who has lost their sense of smell due to COVID and realized that food doesn't quite taste as well, or like anything, could tell you that our senses are quite interconnected and work together as a team. This is true in infancy as well. The senses work as a team, with the brain integrating information from each of the senses together to support learning. Now let's take a look at motor development. Although this is clearly not one of the senses, movement is one of the most important ways in which infants explore the environment. Some of the first types of movements we see in infants are involuntary movements triggered by specific stimuli. These are called reflexes. There's a table of reflexes with their associated stimuli and responses in your text on page 141 that may be especially helpful. An easy one to understand is sucking. When you put pressure on the infant's lips and tongue, they will suck automatically. Obviously, this is helpful for breastfeeding or drinking from a bottle. Breastfeeding is hard enough without having to teach an infant how to suck. Something important to note here is that an infant's suck is underdeveloped and gets more controlled, meaning stronger and more efficient with age, which may be reassuring for mothers who are struggling with nursing in those early days or weeks. Grasping objects also starts off as a reflex, but over time becomes goal-directed. Infants want to touch an object so they can learn more about it, so they reach out and hold on to it tightly when they get it. We see more improvements in this once they have neck and head control so that they are able to sit up independently and explore a little easier. This is why tummy time, where you lay an infant on their belly and allow them to practice lifting their heads, are so important. Now, as a therapist, you'll be assessing for infant development, and an important piece of this is knowing motor milestones. We normally want to know at what age the infant can sit, crawl, stand, and talk. Though your text provides a general age for these on pages 142 and 151, and I've replicated a table below, note that there may be differences due to culture and parental expectations of behavior. For example, a child who's held or placed in a baby carrier for most of the day has less time to attempt crawling. Similarly, with language development, first words typically happen between 12 and 18 months of age, but this will depend on how much the child is exposed to verbal stimuli. An infant whose caregivers talk to them regularly, name objects for them, and reinforce attempts to speak will typically develop language earlier than an infant whose caregivers do not do these things. Okay, so that is everything. Of course, your text in all 50 pages goes into much more detail, but this is a nice little overview of what is important to know. We'll practice how to turn this information into helpful psychoeducation for clients in this week's activity. Thanks for listening.